And we know that medical grade oxygen usage is surging in South Africa amid the second wave of the coronavirus infections. We also know that the emergence of the more transmittable variant of the virus is perhaps one of the main factors behind the rapid surge in the cases. Let's talk now to an oxygen supplier, Ms. Sonia Nell from Ecomed Oxygen Suppliers. Sonia, thank you so much for your time today. When COVID-19 first started and it came into the country, did you, as oxygen suppliers, anticipate the type of demand that there would be for your product?
Good day. Thank you for the opportunity. I would say that definitely from an oxygen point of view, the increased amount of patients, Ecomed has definitely had a noticeable increase in the patient numbers. We have experience of, if you compare to the first wave with current wave, definitely there has been a definite increase in the amount of oxygen.
So give us an idea. What numbers are we talking about here?
Well, you can definitely look at easily, and you can easily look at numbers, 1,000 numbers per month over a December period plus. That with the increase, with Ecomed having different branches, servicing, have a footprint all over. We do have a lot of patients that we assist, and we can definitely see a huge demand in oxygen.
And who would you say, Sonia, have been the main buyers of oxygen?
Well, on our side, we can definitely not refer to them as buyers due to the fact that we have a lot of affiliations with the medical aids. So our major clientele will definitely be our patients, in-hospital patients, will be direct buyers, patients, family, private, medical aid referrals, it will be hospitals, it will be step-down facilities. So definitely from our side, we've seen an increase in buyers. And I also think there is a lot of people that is trying to prepare for whatever might come. So you get people that don't need the oxygen, but will request the oxygen. However, the major increase in clients will definitely be our hospitalized patients, discharged patients, and patients, hospital facilities, frail cares, and facilities like that.
You mentioned, Sonia, a group of individuals who are proactive, who say there might come a time when I myself might need oxygen and are therefore buying oxygen for their homes. What is needed for domestic care if one wants to ensure that they have their own oxygen supply?
So basically, if you want oxygen, at this stage, we definitely have a criteria to follow. We can't just give oxygen as I want to have. It's basically on a medical doctor script. So you need a script for the oxygen. You also will need, obviously, it depends. If it's a COVID patient, there's a criteria. If it's a patient with an underlying condition, chest condition, you'll have another criteria of the requirements that you need. If you've got a claim from a medical aid, you'll have another requirement. But basically, with the current situation, we definitely don't just assist the patient to say, you want the oxygen. We are there. We are a facility that can assist patients. So if a patient needs oxygen, they can contact us. But obviously, we can't just say, while there's people currently in desperate need of oxygen, just to have oxygen available to stand and not be in full capacity use.
If you could talk to us, Sonia, about the options that actually are available without a script for domestic use. I mean, we do know that there are some asthmatic patients, for example, who would have access to nebulizers. Are there any such, machinations that exist for domestic usage?
Yes, definitely. We've got nebulizers. We've got the cylinders. We've got oxygen cylinders. So that will be available without a script. That will be available to patients that don't see a doctor. But oxygen at the end of the day needs to be applied according to a doctor's prescription. So we as a medical company pride ourselves in our service and how we do things. So we won't just give oxygen to a patient on our own according. It will be according to a medical practitioners.
It has been reported that there is a risk of a potential shortage of cylinders with single COVID-19 patients at times using as many as 10 of those cylinders a day. Do you have the capacity to be able to supply these cylinders should there be an escalation in demand?
Ecomed is in a very fortunate position. We were able to, on the first wave, determine and look at our the predictions, our patient counts. So what we did is we prepared for a second wave. Although all of us thought the second wave will be in March, we were in a very fortunate position to have concentrators ready and also to have the relationship of suppliers to continuously and continue flying on in these concentrators. And obviously it will go according to the forecast, and we will still continue to fly in as per requirement, cylinders, concentrators, or any medical equipment.
With Ecomed rather considered, as well as other suppliers, does South Africa have enough of your type of companies, enough suppliers to actually be able to supply the entire country, or do we also import these cylinders?
So we do import. I cannot speak on behalf of any other company, but I must say on behalf of Ecomed Medical, we do have a circulation of our concentrators. So there's always patients that will give up or patients that will unfortunately pass away. And then we do the regular health and safety according to the regular Health and Safety Act. We make sure these concentrators is ready to go back in the field, and obviously then there is a circulation. So on our side, there's also, besides the fact that we are flying in large amounts of equipment, we also have the capacity and the ability to keep these concentrators into circulation.
I'd like you to perhaps give us a comment as to some of the reasons that may exist why there have been shortages of ventilators in some of the hospitals. I know you don't speak on behalf of hospitals, but you may be aware of some of the challenges that may exist, whether it's in procurement or it's in supply, or challenges within the system that have led to some hospitals experiencing shortages in the supply and the availability of ventilators.
I think my comment on that will be that I think this was an unexpected nationwide disaster. Like the president mentioned, this is a declaration of disaster. So I don't think that everybody was prepared for what's coming. And obviously, like I've mentioned, a lot of people predicted that we'll experience this wave in March. And during December, it was a dynamic increase in numbers. So I don't think there was a prediction on any medical hospital or any facility that's foreseen this coming to our country.
What we have seen as well is a rise in other medical related deaths, and this somehow correlating to the rise in COVID-19. Now, you as Ecomed, you sell a variety of medical equipment. Have you seen a rise perhaps in the demand for other sort of medical equipment?
I would definitely say we did. We experience a rise in anything oxygen related. If it's a concentrator, it's a portable concentrator, if it's a cylinder, ventilators, if it's a fingertip pulse oximeter, nebulizers, CPAP equipment. So yes, as a company, I do think that anything oxygen related has demand has definitely increased.
Now, let me ask you this. We've been hearing of stories of individuals going into hospitals and not being able to be admitted in some instances, and then perhaps even having to go back home. What would you recommend from an equipment perspective as perhaps a first line of self-treatment or treatment within the home should one suddenly perhaps experience a downturn in their breathing or ability to breathe?
What my recommendation is on the hospital side, I will definitely, what we've seen hospitals is doing currently is equipping the casualty department. We've assisted several clinics to do outside the clinic a triage system with oxygen concentrators, with pulse oximeters, to be able to evaluate the saturations of these patients and help them to put them on oxygen and see if there's an increase in the saturations. What we also do is, my recommendation would obviously a concentrator or cylinder for home treatment. A pulse oximeter is key at this stage because you can actually determine your saturations and you can monitor it. You can do this from your home. You can see if it's below 90 or if it's below 80. You can check it, and you can also then contact your medical practitioner. And you don't have to go into hospital always to consult. I have noticed that, like I mentioned, there is facilities that have been setting up outside hospitals to assist with this.
Sonia, thank you so much. Very valuable information that you've provided for us. Sonia now there from Ecomed Oxygen Suppliers, and we have seen an increasing rise, as she has said, in the demand for oxygen as well as ventilators.